So still defining or looking at terminologies in orthopedics, when they say something is posterior anterior, what do they mean? So you get to see that this is mostly used in what x-rays, when they say they want to see the posterior anterior view. All right, posterior is the back, anterior they want to look at from the back to the front. You understand? So it just refers to what a standard projection used in radiographic imaging, especially for chest x-rays. You understand? So posterior anterior view, the beam is actually passing from the back to the front of the body. You understand? So key features of this is patient position. So the patient is standing upright, the patient is facing the image receptor. So beam direction, the x-ray enters through the back, exits through the chest. Heart size accuracy, less magnified, okay, less magnified. So the anterior posterior view will basically give you a more accurate representation of the heart size. So scapular position, so shoulders are rotated forward to move the scapulae out of the lung field. Respiration, you take in, all right, full inspiration to expand the lungs and the chest as a whole before they take the x-rays. You understand? So this is how, posterior anterior view, then anterior posterior view. So features is just trying to compare the two views based on these features, right? So beam direction, the posterior anterior view is back to front, while anterior posterior is what? Front to back. Patient position is upright, facing dictator, while this one could be supine or sitting, facing the beam. Heart magnification is minimal. Then anterior posterior view can be used for heart issues because it exaggerates everything. So this one is the posterior anterior is preferred for routine chest examinations, while anterior posterior is if a patient is bedridden, so the person can't really stand up, for a full x-ray. So you just image from the front to back as the person is lying down. You understand? So that's just what it means in x-ray studies.